Welcome to Instruction Discussion, our weekly look at the latest topics and trends in education affecting schools here on Long Island and schools around the world. Whether you're a teacher, parent, or student, listen for tips and strategies to help you navigate the educational landscape. There's a bell. It's time to start today's Instruction Discussion on the voice of Nassau Community College, 90.3 WHPC.
Hello, I'm Kevin Boston Hill, and welcome to Instruction Discussion, where each week we will examine a recent trend or development in education and its impact on Long Island. No matter how hard we try or how much we wish it to go away, it seems that COVID, with all of the new strains popping up, will be around longer than we expected. With different strains, more preparation needs to be taken to minimize the effects. This preparation becomes increasingly important as millions of students across the country head back to school. According to the Association of American Medical Colleges, or AAMC, only 5% of children aged 6 months to 4 years have received at least one dose of a COVID-19 vaccine, while 30% of children between 5 and 11 and 60% of children between 12 and 17 have completed the initial 2-dose series. There are still about 42.3 million children in the United States who are currently unvaccinated. To help us understand the implications of not being vaccinated or otherwise prepared for current and future strains of the virus, today we welcome Dr. Malika Fair, Senior Director of Equity and Social Accountability at the Association of American Medical Colleges. Dr. Fair, welcome to Instruction Discussion on 90.3 WHPC.
Thank you. Thank you for having me.
So to get right into it, I guess, what role is the AAMC, or what role is of the AAMC in spreading the news about COVID and what we should do to prepare for future strains?
Well, we know that this pandemic has lasted a lot longer, as you said, than we had hoped. And our role at the Association of American Medical Colleges is to help provide the latest information available, the trusted information that we can, because honestly, we know that every person wants to do the right thing. They want their family to be safe. They want to be safe. They want to provide the right information to those that they're talking to. And so we want to be a part of that. And as physicians, since we represent several physicians across the nation, as well as faculty and others who work in academic medicine, we want to be part of that discussion.
So is there a difference in the level of concern regarding, say, students in a K-12 setting and those who are off to college?
Well, that is a concern, right? Because we feel that the youngest of our population are not being vaccinated. And, and this is an area that I was personally really excited about because I wanted my own daughter to be vaccinated and I couldn't wait until it was released this summer. But we're seeing that a lot of people are scared or just want to wait and see what happens in the next few months or just not interested at all. And unfortunately, we all have to be together on this. We all have to do everything we can to stop this pandemic. And one of the ways that we can do that is to ensure that all of us are vaccinated, especially our young population, which the spreading in that population a lot right now.
So let's talk about those fears for a minute. What are some of the fears that you've been hearing about, the excuses, and I don't want to say excuses, that's kind of harsh, but the reasons that people and families are giving for not getting their young children vaccinated, and what are you and others with the AAMC doing to kind of allay some of those fears?
Well, so we've heard that parents don't want to get their child vaccinated because it's not that bad, that COVID-19, if you get it, that you're not that sick, that you might be out of school for a while, but you're not really going to be hospitalized. You're probably not going to die. And why risk having a vaccine that they're not quite sure about? And I think the danger of that is that there are some children that are getting very sick. And in fact, the children who are the most likely to be ill are the unvaccinated children. And some children are hospitalized. Some children, do have severe and long-term complications. And I hope that parents hear that message, that even if it's a low risk, you don't want that for your child or for anyone that you know.
So we talk about the risk involved. Is there a risk or a higher risk of spreading COVID, especially when we start thinking about the confined spaces such as schools, especially when we think about that students, let's face it, children are not going to stay 6 feet away from each other all day. So what is there an increased risk involving spreading of COVID because of that?
So, when we think about the risk of spreading COVID, yes, it is proximity, how close you can get to someone. Are you in a place that doesn't have great ventilation? Are you, or is everyone in there wearing a mask? And when you take one thing away, then your risk goes up. And if you're unvaccinated, your risk goes up too. So essentially it's a perfect storm, but it's not just being in school that is a risk. It's also how many people in your community have the vaccine and how high is the spread right now. So the CDC is recommending if you have really low spread of COVID-19 in your area, and if that you don't, and if most people have the vaccine and if you've got low spread, then you don't have to wear a mask indoors. But I want my child to continue to wear a mask in school. I hope that the teachers can wear a mask in school. But honestly, it is important that we all think about all the different strategies that are important to prevent the spread. It's not just being inside the classroom. It really can be anywhere. Play dates, going out to dinner, and gathering in people's homes as well.
And I think that's probably one of the things that has kind of lowered people's defenses, so to speak, when it comes to COVID, that during the summertime, we're all hanging out with one another and we're at each other's houses. We're at these parties, block parties and things of that nature. So we're out and about and nobody really has gotten too sick. They may have get a notice about somebody who was sick or had contracted COVID in your group, but then they're not experiencing any symptoms. So what do we do? What do we say to those people who feel that, well, I've been around other people who have had COVID, but I'm not experiencing any symptoms, so should I still get vaccinated?
So I feel like you have to think about all the different answers to that question. The first part is, will I get sick? Maybe not. But if I get COVID-19, will I spread it to someone else? Possibly. Will that person get really sick? And for me, in terms of making sure that my daughter got the vaccine, I had to answer that question. I don't want her to get it. And she is 2 times more likely to get the virus if she's unvaccinated. I also don't want her to spread it to older adults, my parents, for example. I don't want her to have long-term complications, because if you're that one person that gets COVID-19 and you happen to get long-term complications of fatigue and trouble breathing and even heart problems, that's not something that you want to have happen. And then if all those arguments don't work, we want to stop this virus from mutating, from spreading. And, we don't want to have a situation where it's resistant to our vaccines. So I think that all of those arguments are valid there, even if you don't think that you will get the virus at all or get very sick.
Well, based on the rate of which this vaccine or this virus seems to be mutating. I think we're up to strain 6 or 7 by now or something like that. I think the question now isn't so much if I get sick, but when I'm going to get infected. And so I think because of that, people really need to think about getting themselves protected against any virus, especially any future strain, because it seems that each strain that comes out now is a lot more contagious than the previous one. So how can we prepare ourselves for any future strains that might be developing at this point?
Well, I appreciate that question because of the word that you said, prepare. And I think that's exactly what we're trying to do, is we're trying to prepare ourselves by doing the things that we know work, which is getting vaccinated, wearing a mask, trying to social distance if at all possible, trying to avoid crowds, unless it's a relatively safe situation where everyone is masked. And that's what we can do to prepare. And I've heard that question before. It's not a matter of if, but when you get it. And I agree with it. And I feel like when I get, and if I get COVID-19, I want to make sure that I am fully vaccinated to prevent my risk of hospitalization, to prevent my risk of getting a severe illness, and to prevent my risk of dying.
Let's kind of dispel one of these, I don't want to say myths that are out there, but one of the concerns that's out there as far as getting the vaccine. And you have a lot of people who may say that, well, I know people who have gotten vaccinated and have gotten both doses, have gotten boosted and so forth, and still contracted COVID and so forth. So what's the purpose of getting it if I'm still getting vaccinated if I'm going to get sick anyway? So what do you say to that?
Well, I would say that you have to define sick. We know that the vaccine will not completely prevent you from getting it. It lowers your risk of getting it, but you can still get it. It is going to prevent your risk of getting really sick and ending up in the hospital and dying. And I think that is the message that we have to share, because you may have a cold. You may end up having the flu. You do not want to end up in the hospital. You do not want to get really sick and have something called long COVID. And of course, you don't want to die. The other thing is you don't want to spread it to someone who is sicker than you are. We say medically vulnerable, or someone who has an underlying health condition or does not have an immune system that's strong, or we call that immunocompromised. Because even if you are sick and it's a mild illness and you might have to take off work or take off school, if you pass it along to someone else, it could be dire for them. And so yes, we want you to think about yourself and think about your family, but think about others too.
And I think that's the important message really to send out. It's not just about you and your immediate nuclear family. It's about protecting everyone in our society, within our communities. So basically what you're saying is that I can feel completely fine, but I can still be a carrier and a spreader of the virus, even though I don't have any symptoms myself.
Absolutely. And even the CDC now recommends if you contract and become positive with COVID-19, and if you don't have symptoms, you don't have to stay in your house anymore, but they still want you to wear a mask up to 10 days. And that is because you can still spread the virus, and they want to make sure that people are not spreading it along, even if you have to go to the grocery store and you have to do things to continue your life.
Now, why that particular time frame? Why the 10 days or 5 days or whatever that they're prescribing now? Is that because of the incubation period of the virus, or what does that time frame have to do with?
You know, it's really interesting how this science has evolved. And I know that we've heard different days, whether it's 10 days or 14 days or 5 days. But the beauty of it is that the researchers have been able to look at these data over time, and they're seeing that after about 10 days, you're not really spreading the virus anymore. And you're not usually having symptoms. And because so many people in our nation and world have had it, they've been able to look at these data and accurately tell us when it's safe to go out. But it's not safe to be out without a mask before that 10 days.
What are some of because we know that in certain communities, especially communities of color, that there are certain stigma that's associated with getting vaccinated or just having any type of needle put into their arms. So what are some of the stigma that is being portrayed, and what is the AAMC doing to allay some of those fears and to cut down on the false information that's being put out there?
You know, what we found is that every community has different values and different beliefs about these vaccines. And yes, we've seen some in communities of color and other marginalized groups in our nation, but also in rural communities, varying political beliefs that you can't really predict how someone is going to react to wanting to take or to adopt public health messaging and to take this vaccine. And we as a medical community have had to confront this as well and say, are we trustworthy? How can we be the trusted voice? Because we haven't always been trustworthy historically. And I think now is the time for all of us to say, you know, we are in this together. This is what we know. This is what we don't know. And we're trying to live, and not just live to see tomorrow. We're trying to live without health complications. I hope that those, especially in the Black community where I identify with, that we can talk to physicians who look like us. We can talk to other healthcare providers. We can ask the tough questions. And so we can feel comfortable with something that can save our life.
You are listening to Instruction Discussion on the voice of Nassau Community College, 90.3 WHPC. My name is Kevin Boston Hill, and our guest today is Dr. Malika Fair, Senior Director of Equity and Social Accountability at the Association of American Medical Colleges. As parents and other caregivers start to think about sending their children back to school and whether they should get vaccinated or not, especially when thinking about the young children, are there any side effects or other concerns that they need to be aware of when having those younger children vaccinated?
So I would encourage all parents to look at the CDC's website, to talk to their pediatrician or other healthcare provider about the side effects. They should know that some children will definitely experience some pain in their arm or leg wherever they get their vaccination, maybe experience some fatigue, some difficulty sleeping, maybe even a fever. This does not happen with all children. Some children will not have a reaction at all to the first or second dose, but it may happen, especially if your child has a history of having some sort of severe allergic reaction. Then you should definitely talk to your doctor about that. But side effects of these vaccines are very rare in terms of significant problems with them are very rare. And so we are encouraging everyone to take them because they're safe. And if there is a small reaction, it's usually pretty brief.
Now, we know that, or I mentioned at the top, that only about 5% of toddlers from infant to age 6 or age 5 have actually gotten like the first dose. So what can we do to increase those numbers? Are there any special considerations for that youngest population?
So we are in this back to school time. And so I'm encouraging, and our association is encouraging parents to think about this as their best way to prepare their child, whether they're going to daycare or going to elementary school, and to combine this vaccination with their other immunizations because they are safe and they can be delivered together. And think about this as we going into the fall. We don't know what to expect this fall. This is the best defense that we have to protect our children, since we want them to have a normal fall and a fun fall and winter experience at school.
So you just mentioned that these can be, I don't want to say combined, but they can be taken along with the other immunizations that we have. Is there any studies or any plans to kind of create a sort of a vaccination cocktail where you just combine everything into 1 or 2 doses that can be taken, or do they have to remain separate?
So that's a great question, and thanks for clarifying my use of the word combined. Absolutely, right now we are recommending that the vaccine can be given at the same time as other medication, but they're separate vials. Will that happen in the future? I'm not sure. Many of the childhood immunizations are combined. As we anticipate that this virus continues to mutate, that it may not be the same cocktail every time, but for right now, it is a separate vaccination.
Just for my edification, maybe for some of those others out there, is there a difference between being vaccinated and inoculated? Because we hear those terms, sometimes they're used interchangeably, but I don't think that they're really interchangeable terms. And so let's clear that up a little bit.
So the term inoculation is actually talking about the needle going into the arm, that something is happening there. But being vaccinated in terms of COVID-19 means you've been fully vaccinated. You've had your 2 doses, and maybe even you've had a booster. So I would think of the term vaccination as, have I done what I need to do to prepare myself and to protect myself? Being inoculated really is what happens when you put something into your arm. And really, it's an older term that's used with some previous generation of immunizations. Is
there, or what can schools and teachers and so forth do to kind of prepare their buildings and the classrooms for students to kind of support student safety around spreading of COVID?
I think it has to be a partnership between the teachers and the administration and the school system as well to, of course, talk to parents, encourage vaccination, encourage mask use if that's available and if that's something that the parents and the school wants and is okay by law there. But I think something else that they can do is think about the ventilation. Some schools are opening up windows. They're getting new HVAC systems. They're making sure that there's that high airflow. And that's another line of defense that not just schools, but other institutions are thinking about as one more layer to see if we can clear and prevent the spread of this virus.
And when it comes to the personal protections as far as the carrying around hand sanitizer, you see a lot of people doing that now. Is there a particular, mixture that is more beneficial than others?
We recommend that the hand sanitizer is alcohol-based and that it's used, to cover your entire hands and not just one little part. I think what's interesting about these public health measures is we probably should have been doing this all along. We should have been washing our hands. We should have been using hand sanitizer. We probably shouldn't have been going around coughing on individuals or sneezing on individuals. One of the unintended consequences is I hope that this changes our behavior going forward, that we will be mindful of when we are sick and that we are exposing ourselves to others, and we will take the necessary precautions to wash our hands and to stay as clean as possible.
Should parents start thinking, and other caregivers start thinking about getting their students boosted now, those who have already had the full dosage and so forth? Should they think about getting the booster shot now or kind of wait until the next variant comes out?
I would get the booster shot now. We have no idea what's coming, and we know we're going into the fall, and the cases are still, the virus is still alive and well in this nation and in this world. If you are over the age of 5 and you've already had you're fully vaccinated, as long as it's after 5 months after your last dose, you're eligible to be boosted. If you are over the age of 12 and you have a weakened immune system, or we call that immunocompromised, then you can get your second booster. And if you're over the age of 50, you can get your second booster. I wouldn't recommend that anyone waits at this point. I would get boosted, and so that we can continue to protect ourselves and our families.
And is there a limit to the number of booster shots that you can get, or should people kind of start scheduling that kind of each year before school begins? Let me get my booster shot before we go back to school.
I would mentally prepare for that now, but that's not in the queue yet. I think that this is something that we are going to learn to live with, is just like we do, and we encourage everyone to get a flu shot as well. But right now we have only up to our second booster for those who are over the age of 50 and those who are immunocompromised, and we'll wait and see what the research shows.
Now, there are other, viruses that are coming around that are out there as well. We saw, in particular, the monkeypox. And is there anything that we need to be aware of now to help prepare ourselves for that, the spread of that particular virus into our schools as well as we start to get closer to each other?
I think we have to start by being aware that it exists. By looking at the images, by understanding what the symptoms are, and realizing that anyone can get it. There's been a lot of talk that it's limited to certain populations or men who have sex with men. And I think that we have to understand that it's anyone who has close contact with someone who has it, shares any bed sheets, or has any kind of that personal contact with someone. So it can be any of us, and everyone, teachers, parents, providers should be aware of that and to be on the lookout if someone has fever, fatigue, and especially the classic rash.
And where can people start to go now? I know you mentioned about going on to the CDC website, but is there any other place that people can go to get additional information and other resources that they can use to prepare themselves?
Yes, they can also visit our website at aamc.org. We have information about vaccines on our website, as well as talk to your pediatrician, talk to your family practice physician, whoever gives you your healthcare information. We want to make sure that someone who knows you and your medical history, and that they are advising you in terms of what to do next and how to protect yourself. Now,
I know that you happen to be a trained emergency medicine physician, and you also teach that to future doctors who are coming in that realm as well. So in your experiences, in your travels, what have you seen regarding the firsthand effects of this COVID virus on different patients?
So it's devastating. And I think that the longer that we're in this pandemic, the more that we forget its devastating effects, how many lives that it's taken, and how many people are still experiencing symptoms related to being infected the first time or having a prolonged hospitalization. We talk a lot about how the pandemic is over, or we just have to live with it, but we cannot forget that people died, that we lost so many of our loved ones to this illness. And we are paying for the mental health toll that it took on all of us too. So as an emergency physician, I applaud my colleagues who were on the front line during this entire pandemic, and it took a personal toll on them to see how much death they saw.
And I'm glad you mentioned that last part of it as far as the mental health toll, because I think that's one area that we tend to neglect until it's too late almost. So what should we be looking out for, especially when it comes to our children? What should we be looking out for in terms of mental health in regards to either whether they have COVID or whether the family members have COVID? But what should we be looking out for in order to support them?
We are always looking out for the typical symptoms of fever and cough and runny nose and things of that nature. But in terms of mental health, we have to look out for changes in behavior. Is our child not sleeping well? Are they tearful? Are they not playing as much? Are they avoiding crowds or avoiding other people? We find that children are having depression and they're having anxiety, and adults are too, because this pandemic has gone on for a long time, and we want to be able to live again. We want to be able to be happy and be in a good mental state. And one way to do that is to acknowledge that it's a problem, acknowledge that our mental health has to be a priority, and also to do everything we can to get back to a normal life, including getting vaccinated.
Now, this might be slightly out of your purview, but based on what your experience is, but when it comes to getting help for mental health issues, where can people necessarily go, and how can they pay for it?
So that's a good question. It is different wherever you are, but you can absolutely call. There are hotlines that you can call if you are feeling like you want to hurt yourself or hurt anyone else, for sure. You can always go. I'm an emergency physician. You can always go to your emergency department. We are always open. We will see everyone that comes into our doors. You don't have to feel like you are dying to come to see us. We want to be there for you, even if you feel like you're not sleeping well or you're not eating or you're feeling scared. We are there to help you, and we can call in our mental health professionals to help as well.
So if you had one last thing to leave our audience with regarding the importance of being vaccinated or otherwise prepared against COVID-19, what would that thought be?
I would say it's so important to get vaccinated. We are in this together, and if we want to get out of this together, we all have to do our part.
Thank you for those pearls of wisdom, and we would definitely like to thank our guest today, Dr. Malika Fair, Senior Director of Equity and Social Accountability at the Association of American Medical Colleges, for coming on to our show today.
Thank you for having me.
Once again, my name is Kevin Boston Hill, and thank you all for listening to Instruction Discussion, right here on the voice of Nassau Community College, 90.3 WHPC.